Thank you so much for having me. It is definitely an honor and a privilege to be able to have this space with you all to share about, my experience and the benefit and the joy that can come with working with doulas. So, thank you for that introduction. I think you know a little bit about me, but I want to take it back a little bit and just talk about why I'm even in this work. That's me at about 12 years old with my godmother, who was pretty much the doula of our family, and my first niece, who is now 26 years old, right? So this was an experience for me at 12 years old. I gained a niece and two nephews, and I had a front row seat to the whole pregnancy journey, everything that was going on. And it was so impactful for my experience because I thought, wow, these little people came out of nowhere, and I've been able to see the seed planted to grow, and now they're all grown-ups. And I like to say that was my beginning of my doula work, from assisting especially my sister, who I was closest with her changes in nutrition. She was always taking prenatal vitamins, and then I got to go to the actual birth and at Altabates in Oakland. And it was this experience that was so different than anything I had seen on TV and anything that I could imagine. And as my brothers and sisters, who are all 8 to 18 years older than me, continued to grow their families, I got more and more experiences in watching the pregnancy journey, and each one was different. And so at that point, I thought, oh, I'm going to be a pediatrician so that I can work with babies. I didn't know that there was even a line of work that would allow me to assist people with their pregnancy journeys. And as I went through my experiences, I learned more and more that this is something that can help people. And this is something that aligns with my desires that I had kind of confused with being a pediatrician. And it wasn't until I experienced my own birth that I was able to have assistance from a doula, that firsthand experience, and say, yes, this is what I want to do. So today we're going to just get into it because I really want us to be able to, at the end, discuss the benefits of doula support for the birthing people and the provider, to be able to develop and implement positive and effective engagement with the doulas, to improve the experience for the patients and the outcomes. And we want to be able to implement concrete tools for repairing the rifts in the doula client provider relationship. And we'll talk about some of those rifts and how they're systematic and interpersonal, and how we can address them with having doula support and the way that we engage with our doulas and our patients. Well, your patients, my clients. So I get asked this a lot because doula is a foreign word, and I just want to go through some of the basics of what it is and how there are varying types of doulas and how they may show up in your work and on the floor. So the 1960s Greek definition is not one that I'm a fan of, which means female servant or slave. And I understand why that's definition, but we had to go on and improve that a little bit. So the contemporary definition is a woman, typically without formal obstetric training, who is employed to provide guidance and support to pregnant women during labor. But when we get into it in terms of like the industry of doula, the definition gets a little more specific because it is a trained professional who provides continuous physical, emotional, and informational support to the mother before, during, and shortly after childbirth to help her achieve the healthiest and most satisfying experience possible. These doulas are not members of the hospital, and they're not a part of the social network. When we're talking about the doulas that are engaging here at Sister Web and the community doulas, is really what we're getting back to in terms of supporting especially communities of color and those with greatest disparities. So a community doula are doulas who provide culturally sensitive pregnancy and childbirth education. Beyond that, they help to link them to healthcare, other services and resources. They provide coaching and counseling. They provide breastfeeding promotion. They help with parenting and help the families build attachment. So they're a lot more engaged with the clients than just about their pregnancy and their birth. It's really about that whole person, how they show up in the community, and the type of support that they get. The interesting thing about a community doula is it can be informal and unpaid, and currently most of the models are volunteer based. Even though this type of doula does so much more work, they tend to be the ones who are volunteering because it's really a work of the heart and one of passion. So when you're talking about a sister web doula, we kind of have a blend of some things happening. Sister web is very different because we employ our doulas. Every doula works as an employee with benefits, and that's a lot different than being a private entrepreneur or a community doula who's volunteering. And what a sister web doula does is they're culturally and linguistically congruent. We serve three populations: the Black, Latinx, and Pacific Islanders here in the city of San Francisco. And our doulas come from those same backgrounds. That shared background helps to build trust and a rapport with the mothers who may not know what doula care is, because, like I said, it's kind of a foreign phrase for a lot of people. And there is sometimes a sense of mistrust in the medical team due to past experiences, bias, and just the history of, medical abuse. And so doulas are there to understand that background and also reassure the clients of the care that they can receive. We provide on call support as early as 10 weeks gestation and go until 6 weeks postpartum. This is, I think, a very important point because a lot of times when people are receiving care, they don't have continuity in their provider. They see different people. So when you're dealing with a doula, especially a sister web doula, they've had an extended period of time to build a connection, to build trust and rapport with this client in order for them to open up and really be comfortable to share and have the experience of childbirth that is the most relaxed and without the pressure because they feel the comfort and know that they can trust the person supporting them. And one of the greatest things about Sister Web is that we participate in bi-directional feedback through our Champion Dyad initiative. And that is how I've been able to build such a great relationship with Dr. Norrell, where we're able to every month check in, provide feedback both ways about how doulas are showing up and about how providers are working with our clients. I'll even be able to share some of the stories and feedback that we've gotten from clients that we share. And another thing is that we include that support in coordinating with other essential needs in different meetings. So that's the community aspect where we are linking them to other resources. We may even be going with them to appointments in order to make sure that they're receiving the services that they need. And it's good to know that Sister Web is the only home visiting wellness program in San Francisco where that visitor also is present at the birth, continuing that consistency and continuity and care. Of course, now we've modified due to COVID, but we are still making that connection and being present at the birth. So I just want to take a moment because I gave you a lot of information already, and I'd like for you to think about your experience with doulas. First of all, have you had an experience? Have you worked with a doula before? And if you have, were you aware if they were a community doula, a sister web doula, or a private doula? And then thinking about how was that experience? What were the positive aspects of it? How did having that doula present um, help the patient throughout the process? How did that community feel in the room? And then think about what were some of the challenges that we're facing? What were some of the awkward and uncomfortable moments that may have come up when you have someone else who is there to assist this patient throughout the labor and delivery? I know from my experiences that I've had wonderful times in the delivery room, being there on L&D and working in conjunction with the providers, working with the nurses, and feeling like we are a team, we're rolling, we're all here to hold space. And I've had other times where I felt like I was an imposter, where I felt like what I said was not validated, where I felt like I wasn't welcome in the room, and that I should probably try to stay as far in the cuts as possible in order for my client to receive the care, because my presence in and of itself was a disturbance to the work. So I just want you to take some time and think about it. And as you do that, you heard I'm a practitioner of sound. So I just want to take one deep breath, because this is an emotional topic. We're talking about, bringing in new life and the experiences and all of the options and things that we know can go right and things that can go wrong are held in those moments. And as a doula, when we're coming in, we have great hopes and great advocacy in our heart for our clients to have the best experience. And sometimes that isn't always the case. So I just want to hold a moment for that space and to reflect on that. Being able to hold space is one of the best qualities that a doula can have, because things change so quickly and we're always shifting. So to be able to hold a safe space and a container is really one of the primary functions of a doula. But it's not the only benefit. There are many benefits of birth and postpartum doula support, and there's been evidence-based information that shows that it's clinical benefits, such as reduced use of pain medication, less likely to need forceps and vacuums, better APGAR scores for baby. So those are tangible things that we see happen when you have a doula or someone there providing continuous support. But it's also emotional support that's there. Like I mentioned earlier, doulas have built that connection and that trust over an extended period of time with their clients. So they're able to increase the confidence and boost that self-esteem, to help them deal with their anxiety and be able to improve the mental health even postpartum from having that support. It's also physical support. And this is the part that most people know about with doulas. They're there to help them get up, to increase the movement, improve relaxation, provide that comfort and massage and reassurance, and even there to help with the lactation support. So having a doula there has never found any harm. It's always a benefit, clinically, emotionally, and physically. And this conceptual model shows that the revised version of the Cochrane Review focuses on that continuous support from women during childbirth. Now, this continuous support wasn't even necessarily by a doula, it was just having another person present in that room to be there and support throughout the whole labor and delivery. And this is interesting because if this type of outcomes are able to occur with just someone who isn't even trained and doesn't even have the experience, imagine how amplified this is when you do have a doula who has been to several births, who has studied and knows the process and can help reassure and things go forward. So, like I said, there's no evidence of harms of continuous supportive labor and birth. There is improve outcomes in women and in infants. And those key benefits are shorter labor, higher satisfaction, and better infant outcomes. And who doesn't want those three things? I think we can all say that those are goals that we're working towards together as a team. Shorter labors, higher satisfaction, and babies with better outcomes. That's definitely a success for me. So bringing in those doulas and having them be a part of the team can definitely improve quality of care for all of our clients and your patients. So let's talk about how we bring in the doulas and work with them prenatally, during the birth, and postpartum. And the framework that I use is 4 key steps. It's really about community, communication, boundaries, and flexibility. That's it. You do those 4 things and you're already on a good track. So let's talk about community. What is community? It's a group of people with diverse characteristics who are linked by social ties, share common perspectives, and engage in joint action in a geographical location or setting. The joint action is what we focus on as doulas and care providers. The power of community to create health is far greater than any physician, clinic, or hospital. Mark Hyman, who's an MD, said that. And I believe it. But how do we create this community? How do we, people who are strangers who may have never met each other before, engage in community? And it first starts with assuming good intentions, understanding that we are here for joint action, good outcomes for this mama, good outcomes for this baby. That is our goal as a community. That is our connection. And we have to assume that we're all moving towards that in a positive light together. We have to show each other mutual respect and teamwork and acknowledge that we are moving forward together in this process. Now, the reasons that we at Sister Web focus on particular ethnic groups is because there are disparities. We have a quote here from our Vice President, Kamala Harris, who says, "We need to speak the uncomfortable truth that women, and especially Black women, are too often not listened to or taken seriously by the healthcare system, and therefore they are denied the dignity they deserve." According to the CDC, Black women are 3 times more likely to die from a pregnancy related cause than white women. Multiple factors contribute to these disparities, such as variation in quality health care, underlying chronic conditions, structural racism, and implicit bias. Working with the doula can improve that quality of health care. It can raise that awareness about the implicit biases that are occurring. It can combat the structural racism and assist patients in managing their chronic conditions. So, all of these factors that come in and can be detrimental, especially to Black women, can be assisted and helped and relieved with the support of a doula. And if we understand that joint action of removing these disparities and working towards healthy outcomes, then we realize that we're all a part of the same team, we're all a part of the same community. And when we move forward in that way, we are not replacing or opposing medical staff. We are becoming a part of that and working together for better outcomes. One of my favorite ancestors, Reverend Dr. Martin Luther King Jr., said people fail to get along because they fear each other. They fear each other because they don't know each other. They don't know each other because they have not communicated with each other. You never get a second chance to make that first impression. Communication, our second key step in forming effective bonds and working with doulas, is communication. It's paramount. You have to talk. You got to get to know each other to know what's going on. Because if you know, then you know, right? So we have to be able to communicate and connect with each other and see, what's really going on. What are people here? Why are we here? Are we here together? Or are we here on some separate agenda? So in that first moment, that first impression is 30 seconds of greeting someone. So if you have never met someone and you're trying to create community and open up the communication in that first 30 seconds, show up as your best self. Just 30 seconds. Ask for names. Ask for relationships of who's in the room. Ask for permission to discuss in front of the doula what's going on with the client or the patient. Be open to the feedback and information because that communication is a two-way street. And sometimes it's multiple people on that street and you're on a multi-lane highway. But if you're able to present yourself initially and open up that bridge of communication, then we're starting to form community. And I think one thing I want to point out specifically here is that it's okay. It's really okay to ask for names and relationships. I've been to so many births because I am a community doula. I favor and look like those who I serve. And often I'm assumed to be a sister or auntie. And that is not a good start for opening communication because we started on assumptions. So it's okay to not know, to ask, oh, who are you? What do you hear? What's the connection? Can I share? And build that bridge early on. The great Nat Turner said, good communication is the bridge between confusion and clarity. So when we're communicating, we want clear, concise, and informative conversation. Do you have a doula? Would you like them to be involved? Is it okay for me to speak with them about your care? Giving even the doula suggestions on ways that they can assist. Oh, great. You're the doula. while I'm out of the room, it'd be great if you can make sure she stays hydrated. Let me know if things go on. Use that person as a part of the team who can be your eyes and ears when you're not in the room. And also explain what is happening. Informed consent is one of the biggest advocacies that I practice as a doula in the room, because we know clinicians, you do this all day, every day. It's a part of your flow. You know what's going on. And it's easy when you're comfortable to just keep things moving and not make sure that the audience is understood. And so, in our conversations with our clients, we always ask them, are you okay? Do you understand what was going on? Do you need more questions? And that interruption of a doula can sometimes seem unnecessary, at least. And of opposition a little bit. It can feel like someone's stepping on your toes at most, right? And so if we open it up with that informed consent and making sure that we have understanding, that doula won't have to step in as much. But when you do see that doula stepping in and saying, could you explain what that means, or what's the risk of that? That's a reminder for our clients that they should be asking these questions to get a full understanding. And it's a reminder to you all as a provider that we might need it a little bit more plain. We might need it in a little more layman's term. Even if I myself as a doula understand from my experience, I'm typically asking those questions to make sure that my client is fully informed and can feel good about the decisions moving forward. So that moves us into the third category, the third step, which is boundaries. I love this quote: walls keep everybody out, but boundaries show people where the door is. Thank you, Mark Groves. We all need to know where the exits are. When you sit down on the plane, they say make sure you know where your exits are. They may be behind you, they may be in front of you. When people are creating boundaries, it's not a separation. A boundary is a definite place where your responsibility ends and another person's begins. So we need to have that clarity when we're working together as a team. I need to know that it's not my job to move the IV, to do things that are medical. I know that. But is it my job to perhaps go get a chuck from the pantry? Is it my job to be able to go get ice and water? Let me know where that boundary is, where that line is crossed, so that we don't have any confusion. Elizabeth Earnshaw says, when people set boundaries with you, it's their attempt to continue the relationship with you. It's not an attempt to hurt you. So I'm not going to be offended if you're telling me that I need to step away for this particular procedure. That's the boundary. You know what you need for your work, and I'm going to respect that. But also, there's a boundary when the doula and the client are engaging. They have that trust in that relationship, and you may be asked to give some time so I can speak with my doula. You may be asked to wait just a minute while we finish this conversation. And if it's not an emergency, if it's not a imminent threat, then that space should be given, and that boundary creates some connection and community and some mutual respect. So this open communication gives boundaries space to be accepted. Be explicit about what's accessible, where are items, what parts of the hospital are off limits. Let them know when you plan on returning and what you're looking for. Like I said before, those doulas can be your eyes and ears in the birthing room. That relationship between the doula and the birthing person is sacred, and you don't want to disrupt that and change the energy in the room. And like I said before, a lack of boundaries invites a lack of respect. And we are moving through this journey together in mutual respect and open communication. So the fourth step is definitely flexibility. Be clear about your goal, but be flexible about the process of achieving it. This is something that we talk to our clients about a lot, because birth plans are a big deal. I wanted to go this way and that way. And we always have to say, we can put down these preferences, but you have to be flexible because things change. And let's go through some options of what that would look like if things changed. And this was the circumstance. And it's not the one that you planned for or desired. And we try to get our clients prepared for that because we know every birth is different. But we also give the freedom to say that this is my desired goal. This is what I'm working towards. This is the outcome that I want. And I do believe that I have the capacity to reach that. So it's better to bend than to break. Things change, shifts change, and doulas are key in helping those clients accept the shifts in their birth plan. They're trained to go with the client's wishes, support them in being empowered, advocating, finding solutions. And they're also there to help approach difficult situations with the collective action of better outcomes, what's best for the client, what's best for the baby. So in those moments of shifts, we're okay making things happen. But when we do it as a team, it feels better, right? You have a better perceived sense of your experience. You can look back at it and say, even though that wasn't what I wanted, I still had the information I needed. They communicated with me. I felt supported, and I was able to shift my plan to do what was best for me and the baby. And that is our goal, all of us, for us to do what's best for the client and for the baby. So we also have to know that things don't always move this smoothly, and you're not necessarily coming on a blank slate, right? We have historical context, we have systematic injustices that create rifts between doulas and patients and providers. And it was interesting in a training that we had at Sister Web on perinatal loss. Some of the CNMs said that the institutions are structured to cause harm. They are not set up to be able to provide truly trauma informed, high quality care. And that a lot of times your desires as providers don't go directly in alignment with the protocols that you have to follow within the hospital. So we know there's some internal struggles that are happening because things must be done a certain way. And a lot of us are in this work as a passion from our heart. We really want to be able to show up and support people. So when we're talking about these rifts, it happens on various levels, institutional levels. It happens with the lack of continuity in prenatal care. So there's no ability to build trust, the lack of rapport. And then you go to labor and delivery, and you're going to have a whole new set of people who may not understand you, may not know your beliefs, and feeling like you're going to have to explain everything over again. And in those moments in L&D, our patients often express that they are not looked at as if they have an understanding of what's going on with their body. Like, I know myself, but when I come into the labor and delivery, someone else is the expert of my body. And that's a rift. That's a area. That's a rub where some conflict can arise. And also this idea of feeling like one size fits all. Everything's routine. I'm just another one on the assembly line. They want to get me in and out and move on. These are the type of things that we hear from our clients. And then in the postpartum, it continues with a lack of follow up, more focus on the baby than on the mother's healing, very little preparation for what to expect, and a lack of understanding that when a mom is going home, that community and family structure is very much related to the postpartum healing time and how they can either be cared for or not be cared for in that time. And that's something that doulas fill the gaps in all of these areas. We're able to provide that continuity of care to assure clients that they are the experts on their bodies and to trust themselves and provide that postpartum support. So I wanted to share with you some direct feedback that we've gotten from doulas and clients and talk about how these really show those four key aspects of community, communication, boundaries, and flexibility. So it was reported that one of our clients felt very empowered by it. Speaking of the birth, it sounded like a lot of it had to do with the birth team letting her choose what to do and be on her own time. So when I hear that, I say, yay, great job. This was using that idea of having community, of empowering that client, of saying, you know what, on your own time. That's a boundary. I don't have to push my agenda on you. I can just say yes. We can take that time. But why? I'm letting you know what's going on. The birth team letting her choose her way and her time and not being forced into someone else's plan. That always gives a sense of empowerment and a sense of um, knowing that you were trusted, right? She was trusted by her providers. There was a sense of this person is understands their body and can move forward. And that trust is key. The trust is what bonds us in as community. This other experience, the nurses were wonderful at explaining everything and being a huge informational and emotional support. They continuously gave the client pep talks and words of encouragement around her decision. This is all about communication. Huge informational and emotional support. Those pep talks, showing up and letting people know what's going on. Hey, this is what stage you're at. This is what we're looking for. You're doing great. Baby's heart rate is here. Giving them the information they need to continue on in a process that may be foreign to them, that may be one that they have a little bit of fear about. But that communication, that community is built in to say, you're doing a good job. Here's more information. Oh, here's some choices you have to make. Here's ways that you can go. That's all that we really need in order to feel more in control of the process, and not that we are in someone else's world puppeteering our life and saying which way we go and how we're going to have this sacred experience of birth take place. So before we move on to the other slide, I want to give you a little background because this is direct client feedback, and this is a point where the communication was not so great, and also where some boundaries may have been crossed. This client spoke to us and said that she was interested in doing getting her tubes tied, and she discussed it with her provider prior to the procedure, prior to the birth. They had discussed the options of tubal removal instead, talked about the reality of getting tubes untied and what that would mean, and the cost and how that's not provided. And the client said, I still want to go ahead and do the tubes tied. So when she went in and this procedure was happening, that information that she had received, she had to receive again and again from different providers, from the nurse, from people who were bringing her in. Just so many people came at her with more information about, whoa, you're getting your tubes tied. You could get them removed. Hey, she wants to do this. Isn't it better to do that? And she had already had the information. She had already had that information with someone who she had built community with, her primary provider, someone who she had communicated and gotten informed information about it so that she could make an informed decision about it. She had already said, this is what I want, and thought that that would be the end of the conversation. Yet when she goes in, she feels as if she is bombarded with people giving her more information and trying to convince her to sway her opinion. That's going back to that statement that Vice President made about Black women not feeling like they're being heard or respected or receiving the dignity that they need in the care. So her direct feedback was that she would like for the doctors and nurses to just listen to the patients and trust that they know what they want, to keep their own recommendations and biases out of it. I understand that they had to inform me about the risk. I'm actually glad that they did because it helped me make my decision. But ultimately, after giving me the information, they should have trusted that I was making the best decision for me and respect that. They need to understand it's my choice. When we hear information come back like that, our heart sinks a little bit because with all the informed consent, let your yays be yay and your nays be nay. And that's what my mother used to say. Let your yays be yay and your nays be nay. So if I've made a decision and a choice and I've had that conversation, I'm happy to have the information, then I shouldn't have to defend that to several people on the provider's team, right? Um, the doula also spoke about how this felt for her in the position because there is a power dynamic that exists. And there's risks with the doulas in the institutions because the experts in surgery, the experts in all things medical are not the doulas. And in these moments where we've had our conversations with our clients, we want to support them. It is a fine line because those boundaries have not been set with these providers who don't have that connection or community and haven't built that relationship with the clients. And so we want to encourage, no matter if you're with that person for 5 seconds or 5 months to really take that first step of building that connection, building that community, and communicating with them. The questions from these other doctors and nurses could have been just, oh, so you made your decision. Do you have any questions about that? Not, let's talk about this other thing and go on and on about how you should make a different decision and it's going to be difficult. This particular client also brought up the fact that the cost of having reversing the tying of the tubes would be extreme. And it made her feel as if, so are you then assuming that I don't have the capacity to pay for the health care that I want? Which then breaks those bonds, breaks that trust, and again causes deeper rifts within the relationships. The next instance is one of boundaries, again, and communication not showing up in the room. The client said that she felt overtouched, over-examined to the point that she said she lost count of how many folks came by and touched her. The second piece of feedback was that it felt like things were always changing and she didn't have time to process each move that was happening. So when I hear this, again, I have to take deep breaths and center myself, because if this was not in a hospital setting and someone told me they felt overtouched and didn't know, and that things were happening around them with their body that they didn't know what's happening, I would have to acknowledge that some trauma had taken place for this person. That's the place that I would start as a doula, that, or as a friend, if someone had told me that some trauma had taken place here. And this is about being separate from that client. If you don't know how many people are touching you, who's coming by, there's no connection, there's no community. It sounds like she may not even know who all of these people were in the room. So a vital key aspect of building community and working effectively with doulas is also about building community and working effectively with the clients, for them to feel overtouched and not know what's going on, things happening too quickly, meaning there was not an explanation given to her. That communication wasn't there. She wasn't able to set boundaries about her body and where she didn't or could and not be touched. So there was no room for her to feel comfortable. There was no room for her to experience decreased anxiety, to experience a positive thought afterward, because she is feeling trauma and triggered from this experience of birth that should be one where she feels empowered. So if these steps had been implemented in these situations, we could have had better experiences and more quality healthcare for our clients. So some immediate ways to repair these rifts is, of course, with respectful communication. I love to say the word team because it breaks down to together everyone achieves more. Everyone in that room is a part of the birthing team because they are there, they're influencing it. They have their own opinions and vibes. If it's a doula, if it's a mom or a family member or a friend and that client, everyone there is working towards that joint action. So we are all a part of community, whether we approach it the same way or not, we are all part of that same community. So coming in with that respectful communication is the first way, and I think the most important way to repair any rifts that come up. But also, it's a paradigm shift. I feel like we're in a paradigm shift as a world right now, and this industry is no different. We need to understand and practice in a way that puts pregnancy as a natural part of the reproductive life cycle, a natural part of the human body experience, and understand that the majority of births can happen without interventions, and impart that upon our clients so they're not so fearful and scared in these moments and have to feel like they need to trust some medical aspect if they are having healthy pregnancies. So our education and comfort play a huge role in the experience, and having that shift of, maybe this person does know what's going on with their body. Maybe this is just a part of the natural process, and reassuring them is a much better way to repair and create connection. And of course, the self-awareness. I'm a holistic practitioner. I'm all about self-awareness, meditation, journaling, all of these things that help me know what's going on within myself. And I can say from experience in those times where there were rubs or triggers that arose in situations, it wasn't necessarily the particular situation, but how I viewed it and how I felt it was affecting those around me. So being able to track those internal feelings about a situation, build a deeper understanding of your own reaction, and validate the reaction of others and express how that impacts your actions might impact others is a great way to shift things and immediately repair, because then we're coming from a place of humility, then we're coming from a place of empathy, and we're able to dialogue and work things out with all parties involved. And to effectively work with doulas as part of the care team, you have to have that approach for each person through a lens of cultural competency. And cultural competency isn't this, divine state or place where you're always understanding what's going on. It's a place of humility where you want to learn more, where you want to have more understanding. So it's not you are presenting in this way, client or doula, and I need to let you know what things are going on, but saying, let me get a deeper understanding, to humble yourself, to be quiet. John Coltrane says that when you don't have an understanding of something, you have to go to it. You have to be still. You have to be quiet to get an understanding and to know. And we're dealing with that with each and every one of our clients. Everyone is so different. So that means that when you are not surprised, you're genuinely interested in learning because you want to see and support them in a way that feels good to them, in a way that's going to reach that same destination of better outcomes, better experience. You have to have a place of humility to come from, to really get an understanding of the different cultures and the different dynamics that exist between um, people and in communities. So when you enter a room during a birth, how do you model that open communication? How can you set those boundaries and build those communities? So this is that key step. When you're walking in the room, that first impression, whether it's for a prenatal, postpartum, or an L&D, how do you start building that community right away? How do you start that communication? Introducing yourself to everyone in the room, asking for those specific connections and relationships. Ask about that birth plan and those preferences. See what kind of goals they're coming in with. Gain consent and to discuss in front of visitors and give a clear and concise explanation of what to expect while they're in your care. That has already built in communication, community. You're able to set boundaries and you're able to move forward in this relationship. When you're at a 36-week prenatal appointment and the patient brings in a birth plan with all of these checklist things, how do you shift that from a standard appointment into a moment where you can build community, where you can build trust? Ask about other supports. Invite other community members and those who feel like they are a big part of the team into the appointments. Ask about their cultural practices and things that have happened in past births or family experiences or rituals that they would like to bring in. And inquire about those hopes and fears. Really have those conversations. We know that those meetings are like 15 minutes and you got to keep it moving, but take that time to really engage and build that trust that's going to offer you the support you need in those tough situations when you need to be flexible because you've already built that rapport. And always, always, always offer the clarity. So some of the tools that we bring that you may see and will help you effectively not only work with the doulas, but with the clients is our BRAIN document. This is an acronym for benefits, risk, alternatives, intuition, and need time. And this is something that we tell each and every one of our clients to use prenatal, L&D, postpartum, throughout the whole pregnancy journey, to be able to receive that informed consent, to ask, what are the benefits of what's going on? Are there risks? And what is that risk specifically in this procedure? Are there any alternatives? Is there something else that we can do right now if I'm not comfortable with what you're suggesting? And then we always tell them to trust your own intuition. What is your intuition telling you? How do you move forward? And if it's not an emergency, don't be afraid to say, I need some time. This is where that flexibility comes in for you as a provider. They say, hey, can I have some time to think about this? Sure, let me give you 5 minutes, 10 minutes. If it's not an emergency, then we can move on and let you have the time to make a decision, which is moving you from your plan. So we need to stretch a little bit, so that we can make sure that flexibility is there when we need it. We also always help work clients with their birth plan, with ideal scenarios, possible interventions, emergency procedures, so that our clients come in with an understanding of what all might happen, not just the goals for what they want, but what are all the possibilities of things that may come up. We also normalize that process. Let them know that people have been having babies long before we knew what the heartbeat looked like. People have been having babies long before we had all these interventions. Yes, it was difficult. Yes, we lost people, but it is a part of the normal process. And the majority of the time, especially in the modern world, you're going to be just fine if you're able to continue on and just make those decisions along the way that feel comfortable for you. So here are some tips in creating those positive interactions when you're actually in the hospital, because things are going to come up and you may need to have a moment where you pull that doula aside and have a conversation about what the goal is, or can you assist with, what our goals are for the client. Whatever it is, you may need that space. And one of the key things I want to point out from this list of things to do is giving that headline. And we train our doulas to use the same approach. So you may have a doula who comes to you and says, can I speak to you about what just happened in regards to my client wanting to get some pain medicine? And making sure that you have that permission and you have the space to do it. And then there's some questions to ask in private. We may, beyond just asking these I statements and talking about it, think about how can we from this moment, especially if a rift has occurred, how do we move forward here? How do you feel we can help this client right now move forward with this process? Can we think of something that we can work together, bringing in that teamwork, bringing in that connection to each other, once again, is the key in having those positive interactions. So we're almost out of time. To review, the benefits of doula support are clinical, emotional, and physical. To effectively work with doulas, we got to build community. We got to have open communication, set those boundaries, and be flexible. Doulas use these same practices with their clients, as well as providing non-judgmental physical, emotional, and educational support, normalizing the pregnancy journey, positioning the client as that expert, and building a trusting relationship with the client and empowering them with skills for themselves. I put these here because these are all ways that we can work together as a team. Imagine if our joint action is providing non-judgmental care, providing a normal aspect of pregnancy so they can feel comfortable moving forward, positioning them in the experts of their own experience. That in and of itself creates a whole different paradigm for us to be in terms of our thought patterns, in terms of the way that we approach each and every situation with our clients. Also, the tools for repairing the rifts. Self-awareness, number one. Shifting the paradigm and realizing that this is a part of the natural journey and we can have a normal pregnancy and we intervene when it's necessary. Having respectful communication and consistent prenatal care to build the trust and communication in that relationship. And we always come back to the fore of acknowledge community, foster respectful communication, set clear boundaries, and be flexible. So that is that. I think we're right on time. I feel like I rushed through some things, but if there are any questions, I would love to take those now.
Thank you so much for this talk. It's so helpful. I have a question for you. One of the things that I have found maybe the most challenging in working with doulas in my experience has been the moment of sort of recommending a C-section. And I'm interested in if you have any suggestions in the best ways to sort of communicate that. I think I've learned just a lot from what you've already shared in terms of it's not an emergency, take time, leave the room, all of those things. But just interested in your thoughts.
Yeah, very rarely do we have clients who go into the pregnancy journey wanting a C-section, right? And we've heard a lot of things about the dangers. And so there's a lot of fear, basically, about people going into C-sections, and a lot of grief in terms of the hopes and wishes of wanting to have a vaginal birth. And so I think in those moments, we have to, it's really about the approach, because sometimes it's necessary, and often when it's necessary, it can be an emergency situation, which we've seen. So that makes it difficult for us to take the time and go through all the steps to make people feel good about the decision. But we have those other occasions where it's not an emergency and we have the time and space to think about it. I actually attended a birth Juneteenth 2020 for a client at Kaiser SF who we were attempting to do a version to turn the baby, and she really, really wanted to have a vaginal birth. And what was good about this was she was able to have many conversations with the doctors about what it meant, many conversations about what the alternatives were, and to say, okay, if I do have to do a C-section, what will that look like? I think there's a lot of mystery around what that means, what recovery means. And so giving them that full picture to come along on the journey, to be able to say, okay, I can give up my hopes and dreams for what was going to happen and do what's best for baby. But that's always a hard one. I don't think there is a cookie cutter answer. It's all about that informed consent, giving the time and space, and holding that space for the client who is going through a little bit of grief about losing what they were moving forward and hoping to achieve with their labor and delivery.
Thank you. Would you also be able to maybe briefly talk about how we help our patients, like in the clinic room, sign up for a sister web doula, what the steps are on the
Definitely.
website?
Yes, of course, because we want you to sign everybody up. Our eligibility period is from 10 weeks gestation to 28 weeks. If they are Black, self-identified as Black, African American, Pacific Islander, or Latinx, and live and birth in San Francisco, then they are eligible for a sister web doula based on our capacity. You can definitely go to sisterweb.org and click request a doula. There, the information will pop up in terms of general information about the client or patient name, due date, where they're receiving their care. And that information comes into our communication administrator, who will then filter it out to the three programs based on our capacity, if we have space for them, and whether or not they identify with one of the three ethnic groups we serve. And we like to stay in contact. I think the big thing with Sister Web is building that community and teamwork. So we encourage, and we also have them sign a contract that allows us to communicate with other, providers or CBOs that they're engaged with. And so that's the beginning of the relationship. They'll get connected with our doula coordinators who will do the intake and then match them to a doula team. We work in cohorts of 2 or 3. And so that way we make sure that our clients always are provided with care. No one is left alone if somebody's out sick or on vacation. We make sure that they have a team of support and provide that care, like I said, all the way through 6 weeks postpartum.
Awesome.
You can
Thank you.
also fax it in. That's kind of the old school way if you have the form and you want to fax it in. But the most easy way is to just go to the website and fill it out. I know Dr. Norell is really good at doing that with the clients when they're right there in the room, getting them to sign up and being able to make sure they're connected early on.
Thank you. Does anybody else have questions? Looks like.
Hi, good morning. It's Laura Norell. I just wanted to give a shout out to Celeste Swain, who's been working with me on our sister web relationship, and she gave a talk to the doulas um, a month or two ago about contraception, and so to just give them an overview of how we think about contraception counseling, especially in the immediate postpartum period when the immediate Nexplanon or IUD or tubal might occur. And so we're hoping that that information can all get translated with the patients and on their birth preferences so that they're also more consistent about having birth preferences. So thank you, Dr. Swain, for doing that educational.
Yes, that was well received by our doulas, and they have incorporated into their prenatal care. And I'm so glad you brought that up, Dr. Norell, because that is one of those areas of contention due to historical, troubles that have gone on in the past when it comes to contraceptive, especially with people of color, and that immediately, like, I just had a baby, and now you want to talk about contraceptive where I'm not even thinking about having sex, comes up often. And having the perspective of what the providers are, approaching the clients with has really been helpful for our doulas to help ease that communication with providers about it, because now they understand, oh, it's not just me. They're not trying to, just cut down population with me, but this is a concern and something that I should be thinking about in my overall health and wellness. So that was a great assistance. Thank you, Celeste.
And one more question in the chat. So beyond these awesome general tips for good relationships and practices in working with doulas, do you have any specific advice for residents who are inherently learners and may not have all the answers right away in interacting with doulas?
I think it's coming from that space of not having all the answers. I know even in doula work, when we're new and we're trying to get everything going, we often present ourselves as more knowledgeable than we are. We often, feel like we have to hold this dynamic, this power dynamic, but coming in on the equal level, like, I'm a resident, I'm learning. You may have attended more births than me as a doula. Let's be in this together. And so not being afraid to ask the questions, not being able to state that you are learning, and being open to the reaction or response that you may get from clients and family members who are like, I don't want nobody new over here messing with me, right? Like, I'm already working with this doula, which is a new aspect of someone all up in my life, all up in my business. And so coming from that place of humility helps so much in all situations. And as a resident working on that bedside manner, seeing how doulas work, I think a lot of the times, because you may not be doing the actual hands-on stuff, seeing those other ways to support the client and the patient can be helpful in your own growth and your own learning.
Well, thank you so much, Marlia. I think it's time for us to stop, but we've learned so much, and I really hope that everyone takes advantage of everything we've learned today to really support our patients going forward. So thank you.
Thank you so much, and I hope you all have much success in all of your endeavors moving forward.
Thank you, Marley. That was fantastic. Appreciate it.
Okay.
Have a good day.